Let's continue here. The health department is facing a dilemma: what to do with millions of unused COVID-19 vaccines and incoming deliveries. It comes as the country's vaccination drive has come to a complete standstill. Less than half of the adult population has received their shots so far. We're joined now by the health department's Dr. Nicholas Crisp. Dr. Crisp, good evening to you. Thanks for your time. So the irony of the situation, of course, is that we move from really a shortage of vaccines, needing vaccines, to eventually getting that supply, and now nobody wants them.
Yeah, good evening, Kathy, and good evening to the viewers. Yeah, that's a good summary of the situation. We really struggled to compete in a very aggressive global market at the time when we were trying to buy vaccines. We managed to get a vaccination program started and get on top of the pandemic. And then as it petered out, people have got COVID fatigue. They've got a bit of hesitancy, and we are just not seeing the numbers of people coming for vaccinations.
Is this a failure of government's vaccination campaign?
Well, I would say it's a failure of society. That's the problem. We bought for 41 million people, which was the target, enough vaccines to cover 41 million people with a split amongst two vaccines. And we have only reached 23 million people. So the rest of the people either don't feel the need to vaccinate or are not convinced that there's a risk anymore, or they just now that COVID is gone, don't perceive that there's any need for them to be vaccinated.
There are those who believe that if the messaging around vaccines from the get-go had been well undertaken by government, and if the trust deficit that we see existing, particularly in what was said about vaccines, that if that had been better managed, then we would have seen a greater uptake. Your response?
Yeah, well, it's easy to be smart after the time. There were a lot of moving parts in the middle of a pandemic, and there were those who told us we would never vaccinate 5 million people, and who were very surprised when we crossed 10, very even more surprised when we crossed 20 million. So, these targets are very hard to predict and very difficult to know what's going to happen. Is there a trust deficit? Yeah, there is very much a trust deficit, and that trust deficit is in government, in departments, in the establishments, in health professions, everywhere. We've got a very cynical society at the moment, not inexplicably. And unfortunately, during this very difficult time of COVID, it has negatively impacted on people's lives. But for those who did get vaccinated, they are protected and have been protected, and we would have seen far more loss of life had we not vaccinated people.
What happens now, because we know that already with the vaccines that you've had to get rid of, there certainly is not an appetite, and yet we're expecting more supply. How do you try and manage that to ensure that we're not losing any more money to these vaccines?
Yeah, so Kathy, look, it's complicated, but I'll try and get the salient points are that we had to pay down payments, deposits on the vaccines when we placed the orders. So quite a lot of the money has already been paid for vaccines. All of the Pfizer vaccine was paid for some time ago. So the Pfizer vaccine that came from Pfizer on bilateral purchases is paid for, and there are about 8.4 million doses in the country at the moment. Now that vaccine, nobody really understood how stable it would be. Unfortunately, it's more stable than it originally was thought to be. So we have been getting extensions on the shelf life of that vaccine, and we've been trying to donate a part of that stash that we have. So that's the Pfizer vaccine. Johnson & Johnson vaccine, we have close to 10 million doses in the country, but that's got a far longer shelf life, so at least a year left. And but that's not the only vaccine. The problem is that we have a commitment for another 11 million doses. Now, you'll remember that at the time when we started the vaccination program, Johnson & Johnson globally had a big problem with the shutdown of their entire global production and distribution. And for months, we didn't get any. And now we are getting it. So we've been trying to delay and negotiate our way out of those deliveries, but unfortunately, we're not winning on that. So we've been trying to donate a large portion of those vaccines to other countries. It's complicated because they have to have a no-fault compensation scheme. Otherwise, the company will not allow us to donate them. And not all the countries that we would like to donate to are capable of supporting a no-fault compensation scheme. So we are now working with the big global suppliers like COVAX, and in the African context with the Africa CDC and AVAC, to see whether there are ways we can donate to countries and at least have the vaccine used.
Dr. Chris, briefly, how much is it costing us?
Well, what we stand to lose, I guess, it's difficult on the swings and roundabouts, but we are bound to lose over R1 billion in this process of vaccines that we will either donate or have to eventually destroy.
Dr. Nicholas Crisp, we'll leave it there for tonight.